Every 2 seconds, someone in the United States needs blood. The blood supply in hospitals is constantly experiencing shortages, but with the COVID-19 pandemic, the need for blood has skyrocketed. Voluntary blood donations are the only source of blood for hospitals across the nation. As a regular blood donor with family members who have needed a blood transfusion, a blood drive coordinator at my workplace, and through research on this topic, I have come to find how important it is for blood to be readily available in hospitals. Today, we'll take a look at the problem of the blood supply shortage in the United States, what's causing it, and how and why we should help. Let's take a look at the problem. There is currently a critical shortage in the blood supply in hospitals across the United States. Cancer patients, victims of car crashes, and surgical patients, including babies, are only some of the many people that could require a blood transfusion at any given moment. According to CNN's Shelby Erdman and Jamie Gumbricht, the blood supply shortages are so bad, they've prompted the FDA to revise their deferral period from 12 months to 3 months for certain donors. Some of those donors could be people that have recently gotten tattoos or maybe traveled to a country where malaria exposure is a risk. Now that you know about the problem, let's look at what's causing it. The COVID-19 pandemic has triggered an unprecedented amount of blood drive cancellations. According to the American Red Cross, more than 80% of the blood they collect comes from drives held at places such as churches and schools and workplaces. So the cancellations that have resulted from this pandemic have cut down the number of donations by 86,000 since the month of March. Another factor that causes a shortage in the blood supply is the lack of donors. Volunteer donors are the only source of blood for hospitals across the United States. So the less people that donate, the less lives that can be saved. According to blooddrivesafety.com, some of the most common reasons people give for not donating are fear of needles, or they think that people already give enough, or they think that giving once a year is sufficient. Now, let's look at how and why we can help. Becoming a regular blood donor is the only way in which we can help alleviate this problem. An article on the University of Maryland Medical Center's website tells us that the average adult has 10 to 12 pints of blood. And when we donate 1 pint, our body can replenish that within 24 hours of our donation. 1 donation can save up to 3 lives. So when we donate 1 pint, just 1 pint, we can make a difference, a life or death difference in the life of someone. According to Erica Serino of Healthline.com, donors with blood type O are the most sought because they're considered universal donors, meaning their blood can be matched with any of the 4 types, A, B, AB, and O. But regardless of your blood type, your donation is equally important and crucially needed. The blood donation process is simple. Anyone over the age of 17 who weighs 110 pounds or more can volunteer to donate. Donors must present valid ID and undergo a brief health screening. The cumulative process lasts about an hour, but the actual donation part only lasts 10 to 15 minutes. Although donating blood is often associated with bruising and dizziness and other mild discomfort, there's actually several health benefits to donating blood regularly. Adrian Santos Longhurst of Healthline.com tells us that donating blood regularly may lower iron stores, which are known or believed to increase the risk of heart attack. When we donate blood, we also undergo a free health screening. Our blood pressure, hemoglobin level, weight, temperature, that's all checked. In addition, our blood is tested for hepatitis B and C, among other diseases. So, now that you know about this issue, it is important that you act. Anyone in the Middle Tennessee area who wishes to donate blood can visit the American Red Cross Blood Donation Center in Murfreesboro, or you can log on to redcrossblood.org and find your nearest blood drive. Roll up your sleeve and become a regular blood donor. And if you're hesitant about doing it, think about this. Your donation could help save someone's child, someone's spouse, someone's grandparent. Pay it forward, because none of us know if tomorrow it'll be us or one of our loved ones laying in a hospital bed praying that someone somewhere decided to be courageous and give a precious, priceless gift, their blood. Thank you.